Hello everyone, myself Dr. Manisha Kulkarni. I am working as a senior consultant in Obstetrics and Gynecology in Momstory Hospital, Hadapsar by Sahyadri Groups of Hospital. Today we will learn something about cancer of the cervix. Cancer of the cervix is a cancer which affects the lower part of the uterus, or we can say this is the cancer of the mouth of the uterus. We call it as a silent killer because this cancer initially grows very slowly and it doesn't have any symptoms. So here comes the part of screening test. So we advise certain screening tests to catch this cancer in its early stages so that it can be treated and cured in early stages. So this screening we advise starting from the age of 21 till the age of 65 years in all females who are sexually active. In the age group of 21 to 30, we advise this screening test as pap smear every 3 years. And after the age of 29 till the age of 65, we recommend pap smear every 3 years or pap smear and HPV DNA testing, which is called as co-testing, every 5 years or HPV DNA every 5 years. So today we will learn about symptoms or signs of carcinoma of the cervix. The most important sign of this cancer is bleeding. This bleeding can be your regular menstrual bleeding, but which prolongs or which is of prolonged duration, or heavy menstrual bleeding. This bleeding can also present as intermenstrual bleeding, which means bleeding which happens between your two regular spaced periods. This bleeding can also be postmenopausal bleeding in elderlies. Postmenopausal bleeding is bleeding in an elderly female who has already achieved her menopause. This bleeding can also represent as postcoital bleeding, which means bleeding after the sexual act. If you experience any of these symptoms, you immediately consult your gynecologist. The next symptom can be vaginal discharge. This vaginal discharge can be a persistent one, or this can also be copious vaginal discharge, purulent vaginal discharge, foul smelling vaginal discharge, or sometimes vaginal discharge which is mixed with a blood tinge. In its later stages of cancer of the cervix, one can also present with perrectal bleeding, and when it spreads, many patients also present with tiredness, weakness, fatigue and generalized nausea or decreased appetite, etc. If you face any of these symptoms, immediately visit your gynecologist, and you can also visit us at Momstory, Hadapsar. Thank you.